X-rays can be considered as the photographs of the inner body parts. Whether you are a seasoned doctor or a medical student, understanding an X-ray is crucial for your day-to-day practice. So let's get started. In the assessment, we need to check the patient details and image quality. Usually the patient details include name, identification number, the time and the date the film taken, printed in the corner of the film. Usually the abdominal X-rays are in anteroposterior projection. Check whether they was taken in supine or erect posture. The whole abdomen should be visible in the X-ray, from the level of diaphragm to the pelvis. And usually the retroperitoneal structures are not clearly visible in abdominal X-ray. Interpretation of X-ray followed the BBC approach. Here we first comment about the bowel and other organs, then bones, and then calcification and artifacts. In the bowels, we need to differentiate small intestine from large intestine. The small intestine usually lies more centrally and the large intestine frame it. The large intestine features pouches, which known as rostra. After the identification of large intestine and small intestine, you need to check the bowel diameters. Here we use 3, 6, 9 rule. This represents the upper limit for the normal diameter of different bowel segment. In small intestine, it's 3 cm, colon 6 cm, and cecum it's 9 cm. In small intestinal obstruction, you can see the dilation of small intestine and more prominent valvular connivance. This forms the coil spring appearance in X-ray. If you are suspecting an obstructed inguinal hernia, you should always check the inguinal regions in X-ray. The most common causes of large intestinal obstruction are colorectal carcinomas, strictures, volvulus, and complicated hernias. In sigmoid volvulus, you can see the characteristic coffee bean appearance, and in cecal volvulus, it shows fetal appearance. In normal abdominal X-ray, only the inner wall of intestine should be visible, and in pneumoperitoneum the both sides of bowel can be seen, and this is called as Riddler's sign. The stomach air bubbles can be seen in the left upper quadrant and in midline. The psoas muscle makes the relatively straight line on each side of lumbar vertebra. Kidneys are usually visible. Right is usually lower than the left. Bladder, spleen, gallbladder and liver are the other organs which can be seen on abdominal X-ray. In abdominal X-ray, there are large varieties of bones can be seen. These bony structures are useful as landmarks. A wide range of bony pathologies can be identified on abdominal X-rays, such as osteoarthritis, fractures, Paget disease, and bony metastasis. Here, what we are seeing is sclerotic bony mass in a male patient with prostate cancer. X-rays cannot penetrate bones and metal structures. They are visualized as high-density areas. In X-ray, you can see calcified gallstones, renal calculi, pancreatic calcifications, vascular calcification, costochondral calcification, surgical clips, and jewelries. Here you can see the staghorn calculi in left kidney and pancreatic calcifications. Thank you for watching this video. We will meet you in our next video. Until then, happy learning.